Yeah, so it's actually been really cool for me to see the different opportunities that have come up. So when I started, I was afloat. I was part-time and I would go wherever they needed me, which was a good way to kind of get exposed to the different floors of the hospital. Then after a few months, a full-time position opened up, which happened to be on the medical oncology and surgical transplant floors. So I did that for a few years and had an opportunity to get involved in what's called a cancer work group, just kind of learning with collaborating with other people throughout Intermountain, PTs, OTs, doctors, speech therapists, to kind of standardize cancer care. And then an opening opened up on our trauma units, and I've been interested in that since school, so I applied for that and got that job. So I've transitioned now to working on trauma, and then kind of shortly thereafter, there was an opportunity to start working more in the emergency department, and I started there kind of just filling in when they needed help, and then I started doing that once a week, and now up to twice a week. And through that, I've had more opportunities open up to me. I've gotten to go to a couple of vestibular courses, which is kind of this niche where we deal with dizzy patients, and it's highly applicable in the emergency department down there. And then through that, I got to go to this kind of this prestigious 6-day course and got this goggles, and now I've got a lot more training than I ever had before on how to do the vestibular stuff. And sometimes I get calls from other therapists saying, hey, I've got this dizzy patient, could you come see it, could you bring the goggles? And that's been really fun. It's definitely a lot of growth and getting to try new things, and getting to learn from other people. I'm now involved in a task force in the emergency department, working on standardizing our concussion care. There's a role called the clinical champion that they supported, where I get to do in-services on the training that I got, like in the vestibular course, and share that with my colleagues, and just work on implementing some new things in the emergency department. And it's been really fun and pretty fulfilling. So.